Well, we can talk more about monkeypox. Placide Mbala is a virologist who heads the genomics lab at the National Institute of Biomedical. He joins us from Kinshasa in DR Congo. Thanks very much for speaking to France 24, Placide. We know the virus then has been circulating on the African continent for decades. More than 1,400 suspected cases, 66 deaths so far this year. Walk us through, Placide, if you will, where are we with monkeypox on the African continent?
So we know that monkeypox was discovered for the first time in Central Africa in back 1980 and 1970. So there are sporadic outbreaks occurring in Central Africa and also in West Africa. Most of the time we are providing supportive care because there is no specific treatment and there is no vaccine available to prevent the disease. So with the supportive care, which include all symptomatic drugs that we can provide according to the symptom that the patient can present. And also we had some antibiotics to prevent any super infection. With those treatment, we are able to reduce the mortality rate from 10 to 2%. But the 2%, we think that there is still need of specific treatment, kind of antiviral, and also to use a vaccine for to prevent the disease, mostly for high-risk population. So healthcare worker, people who are living with for hunting and so on. Yeah.
I mean, Placide, you've walked us through some of the treatment that's being offered there. I mean, we're getting reports that some patients are ultimately kind of refusing the treatment. Talk us through some of the fears and what is the stigma attached to monkeypox?
You are breaking up a little bit. Can you repeat the question, please?
I said that there are reports that, some patients are refusing treatment, are, not accepting what's being offered. Talk us through some of the fears of monkeypox and what's the stigma attached to it?
Most of the phase of monkeypox, it's mostly we have the mild, moderate, and severe and grave disease. So most of cases that we are seeing in a non-endemic area are either mild or moderate cases, and most of cases that we see in our country are mostly moderate or severe and even grave disease with a fatality rate that can easily reach about 10% when there is no supportive treatment. Regarding the specific treatment, as I say, there is no specific treatment yet available in our country, and most of the treatment that we provide are supportive treatment. It's the treatment that usually the patients use for other diseases, like when they have fever, they have malaise, they can get the antibiotics. It's the same that they usually use for other diseases. So it's easy for the participant to accept to get the drug. But for the specific treatment, we need a clinical trial to make sure that we can effectively say that those drugs are efficient to treat monkeypox in our context.
Okay, Placide Mbala, you're a virologist speaking to us from Kinshasa in DR Congo. Thank you for your time today.